Oh, good. Wound care, you guys, I really like wound care. You know, you can say, is there anything you don't like? Yeah, I
Right.
don't like A&M leveling, but wound care is really fascinating, and I've wanted to for a while to talk to you guys about the different types of wound care coding and get more involved with that. But this person asked for a little bit of elaboration about wound care, and without giving you codes, I'm going to tell you the areas that you're going to find wound care, and if this is something that you're interested in, and there is plenty of work in this area as a specialty, then these are the things that you need to know, and this is some resources for you as well. So again, it's a fascinating area. These wound care clinics are all over the place. I got some of this information from this heallogic.com, and they have over 800 wound care clinics and did a lot of specialty work. But they are saying that, you know, why would you need to know wound care? Why is this area growing? And this was a really interesting statement. It says diabetes affects 8% of the total U.S. population, an estimated 25 million people, and 26% of Americans over 65. The incidence of chronic wounds, especially foot ulcers, increases among those diagnosed with diabetes. Patients with diabetes are 10 times more likely to require an amputation at some point in their lives. Each year, approximately 700,000 diabetics will undergo an amputation. Now, that's just diabetics in the wound care that is involved with them. There are all kinds of wound care. Before we go into some more, you know, you have the diabetics, but, you know, one of my coworkers when I was working in home health broke her ankle, and there's just not much skin on that little bone sticking out of your ankle, and she ended up going through a wound vac trying to get the skin, you know, that thin layer of skin built up there. And then what happened? She was allergic to the metal that they put in to pin that together. Ended up, once she went through hyperbaric chamber, all this stuff, they had to go in and take it out. She had to do the whole process again. So again, this is not just an old people thing, not just a diabetic thing. This also happens when people get bit by snakes and spiders and stuff like that. So it's quite a vast area. But kind of to sum it up a little bit, the main gist of it, this is not really wound repair coding, because that kind of falls into, you know, when you get a laceration and they go in and stitch you up, or they remove a lesion. You know, this is, I wanted to say that with wound care coding, you do location, length, and complexity. You know, that's pretty much it. And you can do that with this, but these are people in clinics that specialize once the wound has got a problem, there's a complication, it's not healing normally, it's, you know, it's more than the average wound, you know, so wound care coding is a little bit different. This, or wound repair, this is something else. This is a lot of vascular ulcers. Probably the main gist of what they do is that. So with vascular ulcers, what are we talking about? We're talking about ischemic things, venous, all on the venous level, diabetics, small vessel ulcers. Now, what kind of treatments are going on with that type of thing? Well, the common treatments are going to be therapy to improve the circulation, right? We have edema that happens with these wounds, edema reduction therapy, and then we have wound debridement. Now, this is something that when you go to take your CPC exam or you're working, you know, debridement kind of always throws everybody where, you know, is this a complex wound, intermediate, you know, and there's different types of debridement and stuff. And then one of the other things that they're doing is topical growth factors in skin. You know, there's all kinds of fascinating things that they do to to help repair the skin and synthetic skin tissues and stuff. And then, of course, they've got specific wound treatment products and substitutes, and pneumatic compression therapy. And we'll talk more about that. So again, these are just kind of the common treatments. So if you want to get into wound care, then these are the types of treatments you need to go and read about. How does it work? Why would you do it? What body parts would you use specific things? What's the latest in those areas? Now, what type of providers are going to be involved in wound care? You'd be surprised, because I was surprised a little bit about these. Vascular medicine, vascular surgeons, internal medicine, podiatry, of course, because so many diabetics have problems with their feet, physical medicine and rehabilitation. If you have a wound care problem and you have to have your toes amputated, it's really hard to walk. And then, of course, dermatology, that would be expected as well, as you're closing those wounds. And then, you could also have a little bit of dermatology, and I would think even plastic surgery involved, as you're trying to cover up and move some of the tissue for these wounds. So again, go in and do some investigation on these specialties and see what's the latest and the greatest and what's going on. Now, advanced wound care treatments. This is the latest and greatest that seems to be working. And at the bottom of this, of course, I love to throw in pictures, right?
Ooh.
So you don't have to there are two kinds. Scroll up real quick, Laureen, and let me read what those two are, because I don't think I know the acronyms. Negative pressure wound therapy. So that's a wound vac, and that's NPWT, negative pressure wound vac. But if you just put in wound vac, VAC, you'll get plenty of information. It works. I've seen it done. Then hyperbaric oxygen therapy, which would be HBOT, and that's where they put you in the hyperbaric chamber. So we think of a hyperbaric chamber as when those divers go down and they get the bends, they get the oxygen in their blood and stuff. But it's also great for wounds. And there's some wounds that it does fantastic for, and there's some wounds that it doesn't work for. So that's a science in and of itself. There are particular spider bites that work really well in the healing, and it does the opposite for another type of venom. So really cool to learn that. If you get a chance, go visit a wound care clinic and have them talk about their, one of my local chapters, we went and did that. So why do they do these two? Well, because it helps with the wound closure, it gives new tissue growth, and it's wound tissue regeneration. Those three things, you Google those, you're going to find a vast amount of information that you need to study and understand. This is like the disease process of what's going on. Now, if we look at those pictures, most wound vacs, this is an abdominal laparotomy that got infected. So there's the large wound on the abdomen. They pack the wound with this sponge, okay, and then they put this vacuum tube in there, and they seal it with the plastic, and then they turn this on. It's got to have a really good seal, and it literally goes. You hear a constant noise, and it's sucking, literally sucking the pressure. Okay, so it's like providing. It doesn't do a hickey. Yeah, but it's really, it's pulling all the circulation, all the oxygen, all of the good stuff up, and then see the difference after a while, and then again the tissue heals from the inside and starts coming together. It is really significantly an improvement in wound care. And then down below, this is what hyperbaric chambers look like in the wound care center. You have to take off all of your, I don't want to say all your clothes. You can't have any metal or anything in there, anything digital and stuff. And it's a very long process, because they build up the pressure, and then after they keep it there, they've got to release it after a long time. This is something that takes several hours. There's an exact science. Nurses and doctors specialize this and go to conferences and stuff, but they have TVs, and they usually, I've never seen really any places that didn't have more than that had more than 3 beds. You can imagine how expensive these beds are. But a wound care clinic off of a hospital or something, they're definitely going to have a hyperbaric chamber, and it is amazing the results that they get from this. So that is something to study as well. All kinds of information out there, and we'll try to add more wound care specifics and how to code scenarios in the future, because there's a lot of requests for that.
You know, I used to do billing for a wound care specialist for a brief period, and it was very interesting but very gross, because
lots of pictures are taken.
On the claim form, type in the description of the wound, and you think, okay, but there's so many adjectives that this gentleman would come up with for describing odors. Like they have to have the odor, the look.
Yeah,
I was like,
they do.
oh. And he loved what he did. And his email address, I won't give you the whole thing, but let's just say the handle was Wound Dude.
You know, another thing that you bring up a really good point, because you have to be incredibly descriptive in wound care. They want to see improvement, and the only way you can see improvement is, the smell. That's very important. The length, the size, the depth, the texture, all of this stuff makes a difference, and they're constantly taking pictures, tons of pictures.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.